Hello everyone! In today's video, we will demonstrate the correct and safe procedure for administering an intramuscular (IM) injection. Before we begin, always ensure you have washed your hands thoroughly and verified the 5 rights of medication administration: right patient, right drug, right dose, right route, and right time. To perform this procedure, you will need the prescribed medication, an appropriately sized syringe, typically 3 ml or 5 ml, alcohol swabs, disposable gloves, a sharps container for safe disposal. Common sites for IM injections include the deltoid muscle in the upper arm or the ventrogluteal site. Today, we are focusing on the deltoid. Locate the acromion process. The injection site is approximately 2 finger widths below it, in the center of the muscle triangle. Clean the top of the vial, draw the medication into the syringe, and ensure all air bubbles are removed. Next, clean the patient's skin using an alcohol swab in a circular motion, moving from the center outward. Allow the skin to air dry completely. Gently stretch the skin at the site. Insert the needle firmly and quickly at a 90-degree angle. Once inserted, depress the plunger slowly and steadily to deliver the medication. Always maintain a steady hand to minimize discomfort. Withdraw the needle quickly and apply light pressure with a clean swab or gauze. Avoid rubbing the area. Immediately dispose of the used syringe in the sharps container to prevent needle stick injuries. I hope this step-by-step guide was helpful for your clinical practice. For more nursing tutorials and medical education, don't forget to subscribe to NurseLogy. Thank you for watching, and I'll see you in the next video.